Welcome back to the podcast. Today, we are going to talk about vaginal laser rejuvenation and the safety of that. And
This is a topic that gets brought up a lot in our office, so we decided to look into it a little bit further, pull up some studies, and then kind of go through that study and break down what our risk factors really are and if there's
yeah,
any validity to that question.
we have done another podcast on basically treatment for urinary incontinence. And we talked about the fact that the latest traditional guidelines do not mention any regenerative or laser treatments. And so, if you have not seen those podcasts, we would encourage you to click the link in the description and go to them. And by the way, click the link and subscribe as well, and share this information with friends. But today, what we're going to do is talk about those regenerative treatments that they didn't mention, which are laser treatments for vaginal area and stress urinary incontinence.
Yeah. And really the safety behind those treatments. So when we're talking about vaginal laser treatments, we're talking about what's called erbium laser treatment. So we're talking about heating the tissue to create a response in the body that's beneficial for women for multiple things, not just urinary incontinence, but also can be for lubrication, blood flow, collagen building,
Vaginal laxity,
laxity.
orgasmic strength, which
Absolutely.
is huge. So,
So, quite a
yeah.
few different things that are clinically indicated for these lasers, particularly to help with. So, today we're going to look at a study and really pick apart okay, what is the efficacy and safety of these lasers?
So when we actually talk about lasers for vaginal rejuvenation, I will say that it's evolved over time. So there actually has been CO2 where it ablates. Erbium does not. Well, actually, some
It can.
erbium can ablate for vaginal rejuvenations. The ones that we use do not, and the one in the study that we're reviewing does not ablate either. And when we talk about ablation, it means you're doing something to the tissue to remove that top layer. So again, when the FDA came out and was questioning safety of lasers on the vaginal tissue, it was 2018,
In
right?
2018. Yep.
And it was, again, ablative modes mainly in play right then. And I still believe that we get such a response with the non-ablative that there's no reason to use ablative. So all of ours are non-ablative. In the
And
study we're going to review is a non-ablative erbium.
exactly, which
So
is really nice because the study does depict that specific patient population that we don't need to have all this downtime. We don't need to be ablative in tissue and still get really good results, minimum downtime, minimum pain, great results.
yes.
And as you mentioned in 2018, when the FDA, came out and made that statement, it did it. They said, if you're going to do these lasers, we need more studies. We need more data.
Yes.
So it was really nice to see clinicians really kind of take charge. And kind of to bring back to the study, it's a very large study. The study title is Safety of Vaginal Erbium Lasers, a review of 113,000 patients treated in the past 8 years. We'll put a link to this study in the show notes, so you're more than welcome to click on it, read it, look into it, verify, comment, join the conversation.
And this is just the beginning of the studies we're going to review for it, because when we talk about there not being science, or at least we talk about the traditional routes not mentioning anything for laser vaginal rejuvenation for incontinence, for instance, like the previous podcast, this is a perfect example of there's studies and there's evidence out there to support the safety, and they are safe in every study. This one goes back, like Faraday said, and it's looking at 8 years of data. It's actually really specifically doing a year in the study, but it actually, when the FDA came out with that warning, they had to go back and review any safety concerns they had since 2012. So there weren't safety concerns. And this one is specifically pointing out the safety in 113,000 patients, like
That's
Faraday
huge.
said.
So when in this study in particular, they looked at 535 providers in 43 different countries for a total of 113,174 patients to be exact. So treatments and adverse effects on treatments, that data is between 2018 and 2019. August of 2018 to April of 2019. Where we get 8 years of data is going back and having those clinicians, providers, practitioners, whatever term you want to use here, and them going back and looking at from 2012 when they were doing these treatments, any adverse effects patients may have had to report in to collect that data over the time frame of 2018 to 2019. So just want to make sure that we're very specific there, that it's two different types of data, right? Whenever you're reviewing a study, the facts matter. We've heard a lot, even just this week, garbage in or garbage out.
Yeah, no, correct.
So
And
we
it's
want to
true,
be
yeah.
accurate when we're speaking on these studies. So, but it's still, that's a huge number of patients to be looking at for this type of treatment, because it is non-traditional, and typically we don't get this kind of data.
Well, and again, I think that even traditional medicine and gynecologists are still there questioning the safety because it's just an unknown. It's not as if they want to necessarily, it's an area of medicine that we weren't trained on. And again, traditional training doesn't include that. And we don't even actually talk about sex often. So, these lasers can be used for that too, but stress incontinence or stress urinary incontinence is probably the primary reason for using these, because that's a pretty objective measure.
Yes.
And in sex and tightness and vaginal tightness and orgasmic strength is more subjective. But when we're talking about these, we'll get to the study results, which are pretty significant, especially on this sample size of 113,000. But then we'll talk a little bit more about what the lasers do and then recap everything that they can work for. But with this, I think the big thing is that all the side effects in a general term were mild to moderate, very transient, and low in frequency.
Low in frequency. So just to kind of call out a couple of those, the highest rated or frequent adverse effect was some vaginal discharge. That was 47 people.
Patients. Yeah,
That's it.
47.
47 patients. So out of that was out of 43,095 patients, 47 reported vaginal discharge.
4%.
Yeah. Only 33 reported pinpoint bleeding, pain during treatment. So not after treatment, during treatment, right? Because it's heat, it's hot. So that is a little bit dependent on the person, where someone may tolerate heat more so than somebody else. But only 30 patients reported that, and then some swelling or edema in 23. So these are very, very, very low numbers and very minimal side effects when you think about
the sample size.
And even the type of side effects that we're having, right? So vaginal discharge, some swelling, some pain during treatment. I mean, if anyone listening has had any medical procedure, any aesthetic treatment, any laser treatment, I highly would doubt that you would say, oh, it was a walk in the park and caused no pain. Most medical treatments have some discomfort, unless you're doing something a little bit more invasive where you're using a lidocaine or a numbing agent or anesthesia.
And especially for a laser treatment, especially skin or aesthetic lasers tend to scare people, or they actually cause some, pain or discomfort. And it doesn't always have to be the case. So again, it's a myth and aesthetic medicine that they have to cause pain or have downtime. They don't. But anyhow, the fact that the vaginal treatments and laser were going into the vaginal canal with a probe that's heating and using that laser energy to actually remodel the tissue, and they have vaginal discharge, some bleeding, a little bit of pain during treatment, but we're talking about 3% that had pain during treatment.
Very, very small amount. And again, I think that is very subjected by the person. Some people tolerate heat more than others, because this is what this is. It's heat. It's heat pulses to heat the tissue to create a response.
Well, and so in our experience, and we do a lot of vaginal laser rejuvenation with women, that hardly anyone has pain with the actual treatments. internally. When we start to come to the outside with the laser, then sometimes it's a little more uncomfortable because you're talking about mucosa, which responds well in the vaginal canal, and in the introitus or the opening, it's a transition zone. And once you come back out, then you're in that transition zone, more sensory fibers, and so they do have more pain when we reach the outside,
Yeah.
but
Or
not internally.
sensitivity. I think what I hear probably more than anything from patients in our practice is it
And
was a little
occasional
warm.
heat, yeah.
Yeah, it was a little
Yeah.
warm. Maybe a little
Yeah.
bit sensitive in certain areas than others, but completely tolerable.
Yeah, I mean,
And would do it again.
pain is almost non-existent with vaginal laser rejuvenation treatments in our practice. But then again, we're talking about 3% here, and it doesn't get specific about what they complained of. But if you're having vaginal dryness, you have, genital urinary syndrome, menopause, and you have some vaginal dryness and pain, and you're putting a speculum in, and the study and the treatment that they were doing was an erbium and erbium YAG treatment with a speculum.
Yeah.
And so putting a speculum in or doing a pelvic exam, which doesn't cause any harm,
Yes.
is also uncomfortable. So I would think that most of that pain is probably actually from the insertion of the device that holds the laser.
Which is true too. So if, like Dr. Durst was saying, if you're having dryness, if you're already having pain with intercourse, and now we're using a probe,
Yes, correct.
internal, for the laser to be able to use the mechanical arm to rotate, to heat the tissue, the probe alone can cause some pain or discomfort, not necessarily the heating or the actual treatment itself.
Correct. And so I think that these are like significant numbers. Again, the top 4 adverse effects in 113,000 patients: vaginal discharge, pinpoint bleeding, pain, and edema, and it ranged from 1% with the swelling to 4% vaginal discharge. So that is low, and everything was transient, not long lasting, no long lasting adverse effects. So,
But I would be very interested to know if that vaginal discharge was that or more lubrication as a result of treatment, which results in more blood flow, which can result in more lubrication. So are we, is it discharge in a negative way, or is it, okay, well, now we're having more
yeah, I mean, I
lubrication as well?
honestly,
It really didn't kind of break down any of that. It didn't break down on if it was infection, non-infection, if it was just lubrication,
yeah. And there's so many things that can be said about that because vaginal discharge, number one, is not a bad adverse. These are mild adverse effects. 2 is, again, as you have an older vagina, it doesn't take insult as well. The pH range that it'll tolerate is very narrow. And so, therefore, anything will irritate it and cause a little discharge. That's not uncommon. That's why even sexual activity does. That's why they get more urinary tract infections. You have atrophy going on. So, that to
having
me,
vaginal discharge prior to treatment, and this is just ongoing, or is it a result of?
Yeah.
So there are definitely some things there that could bring up questions.
correct, because you're using a lubrication to get the device in, so that can cause alone some irritation. So I agree. But overall, that's a mild complaint, and there's nothing long lasting. There were no reported adverse events of significance from 2012 to 2018. So again, we're going to go through different studies like this over time because there's lots of studies on vaginal laser rejuvenation and the safety and the effects of it. And this is something that the American Urologic Association and the recent NIH guidelines did not mention this. It was meds and it was surgery, some inserts, other things, pads. And this is a very viable option. So when we talk about what does it treat? So a lot of times when we're talking about lasers, the laser companies are going to get more specific for stress urinary incontinence or incontinence, I should say, because it can be mixed in urge as well. And vaginal laxity and orgasmic strength and lubrication, they're probably not going to promote as much, but that's what's also treated, like Faraday had said. Lubrication is blood flow. So if you get nerve and blood vessel regeneration and you get increased blood flow, you're going to get increased lubrication. So it helps with that dryness. Laxity And again, orgasmic strength is huge. But that is not going to be probably in many studies. I think there were a couple, so we'll hit on them.
This one specifically points out treatment clinically validated for stress urinary incontinence, vaginal laxity, vaginal relaxation syndrome, pelvic organ prolapse, and some vulvovaginal atrophy.
And the big thing that they really now name like a menopausal syndrome for women is the genital urinary syndrome of menopause. GSM. That's actually pretty common, diagnostic, or diagnosis
So what
now.
all does that really encompass? Is that more like the dryness? It's kind of like all encompass of, because you're menopause, you have atrophy, you have dryness, you have pain with sex, and it kind of all falls under that. It's kind of generic.
It's generic
to kind of cover all these things.
There's lots of terms that they put on there, and we like to talk in just general terms that people are coming to us talking about. So they come in, and incontinence is one of them. Laxity is probably not a huge complaint, but when you ask them, they know. But orgasmic strength, which it takes longer and longer for women to orgasm over time. Dryness is an issue.
Painful intercourse.
Yes.
That's another one because of the dryness.
But pelvic organ prolapse, or like a bladder.
I was waiting for you to hit on that because I already know where you're going with this.
Yeah, so we had recently, again, had a patient come to us very concerned about a diagnosis of a bladder prolapse, to the point where she was so nervous she stopped hiking. And hiking, she had hiked every, 60% of the trails in, the Great Smoky Mountains. And she stopped hiking because she was afraid her bladder was going to fall out. That's how scared she was after she was given the diagnosis, or how she was given the diagnosis. And her exam was nothing special, like something we see on a daily basis. And I say, if I'm looking and doing an exam and I say you're nothing special, it's actually a good thing.
It's a compliment. It's because the one time you don't want to be special, guys. You do not want to be special in our office.
No, and so as you pull out like the speculum, you're naturally going to have some relaxation and a little bit of that prolapse. But this is what we're doing with the vaginal lasers, is we are actually heating to tell the tissue it's injured and to get repair. So we're going to get that collagen remodeling and shortening of the collagen, and then improvement of the blood vessels and blood flow, which again is lubrication, and then nerves and sensitivity and all of that.
So again, all of those benefits from a laser that's heating tissue in non-ablative with minimal side effects, minimal downtime, and no cutting, no surgery.
In office, 1 hour.
Max.
Yes. And again, there is really minimal downtime, and that's patient dependent, because if you're uncomfortable, when we're not ablating, you don't have to have downtime, but if you need it, you're uncomfortable, you have downtime, and that's okay. We do have some laser treatments that require some downtime, but we're very clear with patients when that is necessary. And so, like Faraday said, again, an in-office, 1 hour, a series, but we're talking about a 1 hour treatment each time, no pain, no downtime.
A series sounds like a lot. We're talking 3 treatments. Typically 3 or 4 treatments over a specified time period, and then some maintenance. We all need a little bit of maintenance, guys.
Yeah.
So this isn't a invasive, you're in the office every week, every day. It's 3-4 treatments, and then maintenance, whether it's quarterly, annually, every 6 months, depending on what the condition is and what we're treating. So there isn't a lot of keep up with it.
No.
So it is completely easy and doable for most.
And patients come more proactive than providers in this area. They know what they're looking for, non-traditional methods, and this is one of them. And if they're not offered that by their gynecologists, their primary care doctors, or they're not having those conversations, they end up in front of us having those conversations. So it is something that we love to offer patients, non-traditional, non-medicine, non-surgical ways of addressing issues that we may not find those solutions for in traditional medicine. And again, we're pretty comprehensive. We're not pretty, we are very comprehensive in how we address women's health or men's health. And so, again, we'll talk, cellular health, vaginal cellular health, and, hormones, if hormones may be an issue,
Yes.
supplements that we may need to add, vaginal creams. Like, there's a whole conversation that we have. It's a journey and not just a one time in the office. We get to know our patients very well. And so, again, if you have any questions, please reach out to us. If you want to hear anything else, then let us know.
If
Share
there's
with
a
friends,
study you want us to
subscribe.
review, I mean,
Yes.
that's huge. If there's a study you want us to look at and say, hey, break this down. Is it valid? Is it not? Is this BS?
Yes. Yeah.
Shoot it in our comments. We'd love to read it and
Yeah.
go through it and do that for you guys.
Yeah. And then, of course, if you have any experiences you want to share, please do. What we would like to say is be bold
Be beautiful.
and be sexy.